all four of the candidates talk about repealing the Affordable Care Act. Mm-hmm. How is your stance different from the other three, and what would you do to, what would you put in its place?
Well, first, how is it different than the other three? From day one, I fought Obamacare. And from day one, we actually collected 25,000 signatures when it was first being discussed that were delivered to various offices around the state. So I've been an active opponent of it from day one. Those 25,000 signatures were a significant amount of work. I will never forget Sue and I going into the governor's mansion with 2 dollies full of signatures, because that's what it is, that's what 25,000 is, and delivering it to Jim Doyle with the request that he allow our Attorney General, of course, to join in the fight to stop Obamacare. So I've been at it since day one on it. I'm totally opposed to Obamacare. I think it needs to be repealed. I think I'm probably the only candidate in the race that is talking about the constitutional question that is brought up by the federal government requiring religious institutions to include abortion-causing drugs in their health care plans and dispensing them from their religious hospitals. And I want to be really clear on what that debate to me is all about. I'm pro-life, and you know I believe life begins at conception. That's what my church believes. So there's no question of where I am. But wherever you're at on the abortion issue, the concept of the federal government coming into a religious organization and telling them what they have to do with something that is part of their religion is just plain fundamentally wrong and in clear violation of the First Amendment to our Constitution.
Now, the Obama administration, Kathleen Sebelius would argue that they have made accommodations that deal with that issue by having the insurance companies pick up the tab for that. You don't buy that?
Well, I'm a business person, and I know that when something's covered, you pay for it. No matter what you say about how it's paid for, there's nothing that's for free. So that I don't buy that it's free and somebody else pays. No, I don't buy that. I don't think there's a business owner in America that would buy that. You also asked the replacement, though, and I think that's an important question. Let me start at the 30,000-foot view of that and then bring it down to some specifics for you. I think the most important thing we need to do is get the federal government out of medicine and allow the patient and the doctor to once again be in charge of what happens in the field of medicine. And once again, we want our doctors practicing based on what they believe in the best interest of the patient. Bringing that down from the 30,000 foot to some specifics. First, I would cap rewards in unintentional malpractice so that our doctors aren't practicing looking over their shoulders expecting a lawsuit. Second, I would allow insurance across state lines. As a business owner, I want to sit down with my employees, decide what it is we want in our insurance plan, and then I want to shop and I want to find the most cost-effective way to provide what we decide in our business we want.
On that point, how do you ensure that, as some of the critics have argued, that could lead to a race to the bottom because of different regulations in different states?
Well, I think what we should do is get those regulations out of the way. I mean, this is a much bigger discussion really than just insurance across state lines. It's really, what is the role of the federal government dictating and mandating to an insurance company what's included, as opposed to me as a business owner sitting down with my employees and deciding what it is we want in our policy. A classic example of that would be and you've seen some Republicans saying that 26-year-old kids on the parents' plan is a really good thing. It is a really good thing. And if I'm willing to pay for it and my employees tell me that that's what we want in our plan and that's part of their overall compensation, more power to them. But the federal government stepping in and mandating that every employer provide that, whether or not it's what his employees and the employer want, that's what I'm opposed to. The third thing, and the most important thing that I would mention in my mind in terms of restoring medicine and restoring our healthcare system, we need to reintroduce the free market system into medicine. And we do that through the expansion and the use of health savings accounts.